Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. I hope you're enjoying the longer days of summer. For families, you're maybe getting ready for a return to school, and I look forward to sharing some tips to stay well and stay in person for learning this fall and through the winter. Our status in York Region remains similar to my previous update. The wastewater signal in Ontario has plateaued but remains high, indicating a persistently high level of COVID-19 transmission. The local York Region wastewater levels have decreased somewhat, though not to the levels that we were hoping for at this point. The burden of severe COVID-19 in our hospitals also remains persistently high in York Region and across Ontario. While our high vaccination rates have contributed significantly to protecting us, our immunity is waning. Having a 3 or 4 dose coverage across the board in York Region would make a real difference. Recent data from Public Health Ontario confirms that people with 1 or 2 boosters were well protected from being hospitalized or dying of COVID-19 compared to those with only 2 doses. This includes people who've also had COVID. This is particularly significant among those who are over age 60. 2 doses are simply not enough to protect you from severe illness and hospitalization. If you're 12 years of age or older and have not received a 3rd dose, please do so right away. York Region Public Health clinics are accepting walk-ins for 1st, 2nd, 3rd, or 4th doses. You may have also heard that Health Canada recently approved a 3rd dose or the first booster for kids aged 5 to 11. This was very eagerly anticipated in many families and here at York Region Public Health. We are planning and preparing our clinics to provide this dose to children as we wait to hear more from the province about its plans. Speaking of children and getting ready for back to school, children aged 5 to 11 who haven't received their 1st or 2nd dose should do so now as part of your preparation for the new school year. If a majority of children in your classrooms are vaccinated, both students and teachers will be better protected and better able to spend more time in person where they belong. To find a clinic near you or to book online, please visit york.ca/COVID-19 Vaccine or call Access York at 1-877-464-9675. Appointments continue to be required for children aged 6 months to 4 years of age, but anyone 5+ is able to walk into our clinics for any eligible dose. We're hopeful that the recent plateau in the wastewater signal and in hospitalizations translates into a downward trajectory going forward, but this remains to be seen. We're also very hopeful about the potential of the bivalent Moderna vaccine that is specific for the Omicron variant. This vaccine was approved in the UK just last week, and we look forward to its approval and availability in Canada in the near future. This vaccine will most certainly help to prevent a very challenging wave in Ontario through the fall and winter. I know many of you are thinking about waiting for this bivalent vaccine, which will be available later this year, rather than getting your 4th dose now. This approach is reasonable, but is not to take the place of the 3rd dose, so please make sure to get your 1st booster or your 3rd dose as soon as possible. To learn more and to get answers to other frequently asked questions about COVID-19 vaccine, you can visit our website at york.ca/COVID-19 vaccine info. I can't stress enough how important the vaccine is for protection from severe illness or worse, at the individual and the population level. Sadly, we hit a very somber milestone just last week in York Region, where we reported our 1,000th COVID-19 related death. We are all mourning these losses and know how much COVID has negatively impacted many in our community. These are preventable illnesses and preventable deaths. In addition to keeping up with vaccination, another simple tool we have is masking. While it isn't mandatory, having a mask to wear if you find yourself in close contact with others, particularly those at higher risk, is one small action we can take to prevent ourselves and others from this airborne virus. The summer weather has worked to our advantage, allowing us to gather outdoors as much as possible. As we look forward to the fall, we expect not only COVID-19, but other respiratory infections that we haven't seen over the past couple of years. Please remain COVID-19 aware as the fall approaches, and do your part to keep our community healthy and alleviate the stress on our healthcare system. And have a great rest of your summer.